Hello, and welcome to my office. My name is Dr. Susan Mara, and I'm a naturopathic physician, and I specialize in tick-borne diseases here in Seattle. And today we're going to talk about some of the controversy there is over Lyme disease and multiple sclerosis. The reason that this is a hot topic is that the Pacific Northwest has one of the highest incidences of multiple sclerosis anywhere in the United States. And there's no real explanation for this yet. And so what I'd like to do is I'd like to talk about both multiple sclerosis and Lyme disease and show you some of the similarities that these two diseases share. First of all, Lyme disease is caused by a mobile bacteria called Borrelia burgdorferi. And Borrelia burgdorferi has a particular affinity for areas of the body that have high fat density. And the reason that is that they are unable to manufacture their own fatty acids. So they gravitate towards places in the body where you have high density fatty acids, one of which is the brain. Fatty acids are found in the myelin sheath, which is a covering over the axons that allow for proper conduction of neural information from one neuron to the next. So the fatty acid concentration of the brain is very high, and it's no coincidence that spirochetes, otherwise known as Borrelia, gravitate or are neurophilic to the brain. That's where they like to feed. Some of the symptoms of neurological Lyme disease are numbness and tingling, severe fatigue, head pain, night sweats, slight fevers, memory loss, confusion, pin pricking, and burning sensations. These are all symptoms that are also noted in MS. MS, multiple sclerosis, is known as an autoimmune disease of the neural tissue, whereby the immune system recognizes self-tissue as foreign and mounts an antibody response against your own neural tissue. The reason that this is particularly interesting in light of Lyme disease is that could it be that in many cases of multiple sclerosis, the Borrelia are buried deep within the myelin sheath as they feed on the fatty acids, and the body's immune system recognizes that as foreign and mounts an antibody response, therefore causing it to be an autoimmune disease. There are a few other things that Lyme disease and multiple sclerosis share. For one is Lyme disease can cause white matter lesions. In other words, people who have had Lyme disease for quite some time, several years, say, or longer, can develop white matter lesions in the brain. And this is believed to be due to the damage that spirochetes have done to the white matter. And white matter consists of myelin, and myelin consists of fatty acids. So it appears that the scars that are seen on an MRI, for example, in neuroborreliosis may in fact be due to the damage that's been caused by the bacteria Borrelia. Now in multiple sclerosis, we also see white matter lesions, and their etiology is unknown. We don't know why there are white matter lesions in multiple sclerosis other than the fact that it's an autoimmune disease. What I'm proposing is, could it be that multiple sclerosis white matter lesions are in fact the same as white matter lesions caused by Lyme disease? It's just that in MS, an autoimmune component has developed. Well, one way to test this theory is to administer antibiotics and over a course of several months and see if there's a change in the white matter lesions. If the white matter lesions decrease or the number of the white matter lesions decrease, then you would suspect that there is an infectious etiology to white matter lesion damage. If the white matter lesions don't respond to antibiotics, then it's not likely to be of infectious etiology. So I'd like for you to think about this concept and contemplate about the similarities between neuroborreliosis and multiple sclerosis. Lastly, there is a specific diet called the SWANK diet, which is very low in carbohydrates and very high in fats. And it's been used for many, many years for the treatment of multiple sclerosis. What I'm proposing is if you feed a body that's infected with a bacteria that has a particular affinity for fatty acids, and you feed that body fatty acids, you are feeding those bacteria. And therefore, if you feed those bacteria, you're, in essence, making them happy. And this may decrease symptomatology that we see in multiple sclerosis. It may decrease numbness and tingling, it may decrease fatigue, it may decrease the relapsing or the progression of the disease. I have seen it help many, many, many of my MS patients. So I hope that you'll take this information and either tell a friend or pass it along to somebody that you know is suffering from Lyme or multiple sclerosis, and let them contemplate it as well. Thank you so much, and have a wonderful day.